Okay, now we have diabetes mellitus type 1. She only wants to do type 1 because type 1 is most common in children. So basically, it's a deficiency of insulin secretion due to the pancreatic beta cells damage. Who cares? Causes: genetic predisposition, environmental triggers like chemicals, viruses, toxins. So genetic predisposition could be like the immune system destroys the beta cells. But this part's not super important. Basically, this leads to hyperglycemia. So, signs and symptoms of diabetes mellitus type 1: polyuria. You're going to have lots of diluted urine. Polydipsia, very thirsty. Polyphagia, very hungry, and you're going to have weight loss. Retinopathy, you'll have blurred vision as well. You'll have slow healing wounds. Neuropathy, which is numbness. Headaches, bedwetting because of the polyuria, lots of pee, and a history of poor growth. So this is pretty similar to what we learned in MedSurg. So to diagnose, you're going to do a fasting blood glucose. These are pretty much the same as well. It's going to be more than 126. You can do the 2-hour plasma glucose. It's going to be more than 200. This is during an oral glucose tolerance test, by the way. A random glucose of more than 200. And then the HbA1c is going to be greater than 6.5%. Or 7% in children and adolescents. So that's pretty much the only one that changes. So the normal level for children, this is what Lion said during class, was it's going to be 60 to 100. So treatment, insulin therapy. You can do multiple daily injections or you can do an insulin pump. It'll be subcutaneous, means 45 to 90 degrees. And here's the different types of insulin. So you have the ultra rapid acting. There's one called faster aspart. It's the peak. You want to know this. The peak and duration, she said. You want to know the peak and duration. So ultra rapid acting is 1 to 3 hours peak, and the duration is 3 to 5 hours. Rapid acting, Lispro, 1 to 3 hours peak, 3 to 5 hours duration. Short acting, regular, is 2 to 4 hours in peak and 5 to 8 hours in duration. And then intermediate acting, which is going to be the NPH, the peak is 4 to 12 hours and the duration is 12 to 24 hours. And then you have the long acting, which is like glargine. The peak is at 8 to 12 hours and the duration is 22 to 24 hours. Do not mix long acting insulin with other insulins. Do not do that. You want to keep the insulins at room temperature. And you want to discard after 1 month, even if it's refrigerated after being opened. Sorry, guys. Anyways, so then the blood glucose monitoring, you want to do that. So it'll be frequent checks before meals, at bedtime, and whenever needed. And you want to do continuous glucose monitoring for real-time tracking. So just to make sure that it's always doing good. So you want to monitor for complications. So retinopathy, you want to do an eye exam every 2 years. Nephropathy, annual screening for microalbuminuria. Neuropathy, an annual foot exam. Dyslipidemia, you want to do a lipid profile in children above 2 years old at the diagnosis, and then you're going to repeat it every 3 years. Hypertension, you check your blood pressure every visit. And you want to screen for additional autoimmune disorders and eating disorders. Children with diabetes, a lot of them struggle with eating disorders because they don't want to have this insulin thing. They're eating too much sugar. They begin to starve themselves. Okay, now we're also going to have nursing management. So for the nursing management, you want to teach the parents to rotate the sites. You want to allow the child to choose where they're going to be pricked at or where the injection site is whenever it's possible. And you're going to encourage them to participate in their own care. For hypoglycemia signs and symptoms, you want to know these just in case you have too much insulin or whatever. Behavior change, confusion, slurred speech, diaphoresis, tremors, palpitations, and tachycardia. If this happens and it's severe, you want to administer glucagon subcutaneously or intramuscularly. If they're below 20 kilograms, you want to give 0.5 milligrams of it. If they're above 20 kilograms, you want to give them a whole milligram, 1. Or you can also do dextrose 50% IV Or you can do 10 to 15 grams of carbs like orange juice, peanut butter, and crackers. And if they're going to exercise, you want to give them 15 to 30 grams of carbs for every 45 minutes to an hour of exercise. You also want to double check all insulin doses with another nurse to prevent any complications.